Dr. Patel, walk us through the basics here. What do we know about this current monkeypox outbreak and how it is spreading?
All right, Charles, this is what we know, and it is a bit of a fast-moving target in the sense that cases are cropping up all around the world, including the United States. We have a little over 300 identified cases in the United States. They are linked in general to either travel or, as you mentioned, some very specific events and parties, but there are cases that occur outside of it. In addition to that, interestingly, this is a virus that we've known a lot about. It's been going on for decades in Africa, where we had seen it most commonly. We've had it in the United States before, but not in this degree of spread, Charles, and not over this period of time. Literally over the last weeks, the World Health Organization said we've probably tripled our cases of monkeypox that we've identified so far. Here's the good news, because everything I just told you might scare you. The good news is that it's actually very hard to get monkeypox. You have to have an incredibly direct contact with an individual who is already sick and has symptoms or some of the kind of classic rash. And so it's not something, I don't want people to compare it to COVID, even though in our brains that's where we go. So the good news is also that we have a vaccine that can be incredibly effective, both as prevention and treatment, Charles. And that's exactly, as you mentioned, what the United States made a purchase order of and has distributed across the United States.
Let's talk a little bit about the vaccines, because they're, as you say, finally getting to the hotspots across the country. The United States currently has 2 vaccines in its arsenal. How would you direct people to decide which one of those is best for them, or should you just get whichever one's available to you in your area?
So in all of these areas in which they're available, and still states are still trying to figure out exactly how to distribute it based on the volume of number of cases, Charles, I'll give you what's happening in kind of the DC area. We are not offering a choice because ACAM 2000, let's call that the older smallpox vaccine, which is effective in monkeypox, has a lot more side effects, has a little bit of a distribution issue. When you inject it in your arm, it can cause a big blister. Jynneos is the newer one, less side effects, better tolerated, only approved in 18 and above. So we don't have something for kids yet. And that's what we will be distributing. And people are coming in droves. We're looking at high risk. We're trying to identify people, even if they have not known of direct contact. We're in an area where they know there have been cases.
What is your evaluation of the protocol for the testing for this disease? Do you think that it's being undercounted, or are we doing the best we can, because this is, as you say, not a disease that has spread to this degree in this country before?
All right, Charles, I'm going to be very critical here. I can't help but have my own kind of personal and professional flashbacks to February and March of 2020, where we were desperately on calls with health departments, state, anybody, academic centers saying, hey, can we get this patient tested? And days would go by before we would be able to get an answer. Now, the United States government, the CDC, has stood up an operations center. They stood that up this last week. They've distributed, trying to get tests into commercial labs, meaning labs that are closer to you, Charles, so I don't have to send you to an academic center. But Charles, it's just not good enough. Our testing and contact tracing are not sufficient. We are likely undercounting. And for this reason, I think people watching and listening should speak up, and they should not assume. There have been a heavy population in men who have sex with men, so that is a higher risk population. But don't assume anything, because with COVID, we saw that assumptions were always wrong. So we need to be a little bit more humble. Better to ask than to wait and be presenting too late.